All right, it's 12 o'clock. We're going to go ahead and begin the presentation now. Welcome to talkEHR, the next frontier in electronic health records. We're going to move into a presentation that will answer a number of questions that we have received over the last 2 days. We will, very pleased to announce that we've had over 100 physicians sign up already in just the last 2 days. So we're glad to have you on board for the presentation. So my name is Carl Johnson. I'm the Senior Vice President for talkEHR, product of MTBC, and want to tell you a little bit about what we're doing. I have included my cell phone number here, so if anybody wants to make a note of that, it is 201-805-9402. Please feel free to give me a call anytime with additional questions we don't get to today. From a housekeeping note, on the right-hand side of your screen in the toolbar, there is a chat section. So please feel free to send me a comment or a question during the webinar, and we'll get to those either during the webinar or at the end. So let's just move right ahead here. So to recap a little bit on the functionality of talkEHR, one of the basic premises we have is a natural voice interaction between the physicians and the software. So what we mean by that is basically driven by Google Voice, much like you'd use Siri or Alexa. You're able to talk to the EHR, navigate through the system. This is based on artificial intelligence. And so as you use the system, it's going to become more powerful and more functional for you. So as you go through certain pieces of a chart or go through certain activities, it will learn, and collectively it will learn from across the country with other users. And so we certainly anticipate the voice-activated functions that are driven by this artificial intelligence to improve dramatically. You are joining us at the very outset of the launch. So we appreciate everybody's input, and we'll be looking forward to enhancing the product along the way. Really, one of the other basic premises is that we wanted to make this simple. MTBC, the parent company for talkEHR, has been providing EMR for over a decade, and we have learned from our physicians and how they use the electronic health record and have tried to make it fewer clicks, less time spent writing, quicker to navigate, and just overall simple to use. We do have a number of integrated products that go along with this that are available to you free of charge. E-prescribing is one of those. We have some mHealth or mobile apps that are available to use, and anything from a patient portal to the e-prescribing, as I mentioned, and also appointment reminders, mobile charge capture, and so forth. Integrated into the system is practice management software. So the complete revenue cycle or billing component is available for your use in the system free of charge, as well as an integrated appointment scheduling. A little bit about the history of talkEHR. It was designed and based on feedback from our physicians. It was developed actively with physicians, taking their input, using it in real-life situations on a day-to-day basis. Our plan is to rapidly enhance the product based on input from each of you. We do have embedded in the EMR a user form. Now, in there, you'll be able to communicate with other users of the system, but we'll also be monitoring it and answering questions from our developers and from our experts and physicians that we have on staff to be able to help you make the most out of the EMR. MTBC, as I mentioned, the parent company, has over 12 years of EHR development, and we have a dedicated team of over 200 software developers. I've been getting a lot of questions about the business model. How do you do it for free? My mother told me nothing in life was free. And that is true. As many software companies have done, and we're doing, we've developed the system, we've made the investment, and are offering it to providers at no cost. And when we say no cost, we mean no cost. You're able to go in, sign up, develop an account, start using it, import data yourself, modify the system, create templates, do things that are very functional, and do a lot of that work yourself. We do find it very easy to use, very easy to set up. The added value features and how we monetize this is through our billing services. For over 20 years, we have been a full-service revenue cycle management company. And as a special introductory rate, we're offering full-service billing at 2.95%. And at this rate will be a permanent rate. It's not a teaser rate, but something that will continue to be available to you. We also offer low-cost transcription services and managed care credentialing services. So really that is behind it. You're able to use the system, enjoy the functionality of it, and if you would like help with your revenue cycle, and really who wouldn't, we're there to do that for you as well. So I've got here a little comparison about what's in the free product versus the 2.95% billing. And as you can see, nearly all of the functionality is included in our free option. What would not be included would be faxing, customized websites, and then really the billing services that we would provide. So importing and processing your electronic remittance files, doing denial management and correcting rejections, doing AR follow-up and posting the payment. But these are all things that you could do yourself within the system. We also have available in the Talk Ultimate package for 2.95%, appointment reminder cards. So I wanted to show you just a couple of screens, and this is not intended to be a replacement for a demo, and we would certainly offer anybody who is interested in the demo an opportunity to be one-on-one with a trainer and to be able to see the system. But we have created dashboards that are easy to use, easy to navigate, and you can move around in this dashboard in two different functions using your natural voice. I have a sample of what a completed note might look like. It is a fairly standard format, obviously, as Medicare has given us lots of guidelines on how to complete our medical records so they can decide whether or not we should be paid for our services. But really it is meant to be a very complete, very thorough system, but also very intuitive to use. So as physicians, and especially those who have worked on an EMR before, get into the system, we find that within an hour or two, they're able to navigate the system and complete records and do well on their own. A little bit about MTBC and who we are as a company. We were founded in 1999. We've grown by both organic growth, mostly referrals from existing clients, and acquisition by bringing together billing companies. Like many physician practices that have grown over the years with strength in numbers, we've done the same as a revenue cycle and software company. We do have over 2,000 employees. We have offices in 9 states and in 3 countries, and we've been publicly traded on the NASDAQ since 2014. And if anybody would like to get lots of information, go to NASDAQ, put in the ticker symbol MTBC, and there's lots to read about us there. Now, to contact us, simple to do. Go to talkEHR.com to be able to see the system, more functionality, or to be able to log in and create your own account. You can call us directly at 650-TALK-EHR, or you can email us at hello@talkEHR, or to contact one of the executives. I've listed our emails, a.eunice@mtbc.com or k.johnson@mtbc.com. So that concludes what I had in the way of a formal presentation, and we're prepared to take a couple of questions if anybody has them. All right, our first question comes from an orthopedic surgery practice in Texas, and they're asking, can I import my existing demographics from my billing system? And the answer to that is yes. So certainly we have some tools. If you can format and get your data into an Excel spreadsheet, then we can make that available to you. All right, we have another question here. And this practice asks, are there additional fees for users other than the physicians? And the answer to that is no. You can create as many accounts as you need to. They can be linked together under your practice and have as many users active in the system as you would like. All right, and one last question. Somebody is asking us, does the program interface with Dragon? My physicians have been used to using digital dictation. And the answer to that is yes. If you have a copy of Dragon, we can connect it. You can connect it to the system and are able to integrate your dictation right into the system for your narrative fields. And with that, we intended this to be a brief presentation, but wanted to answer some basic questions. If anybody has any other questions they want to put into the chat box, we're welcome to do that. All right, looks like we've answered all the questions. We thank everybody for their participation in this brief webinar, and we'll be continuing to do some additional webinars, answering people's questions as they arise, but also doing some group demonstrations and some training sessions along the way. Thank you very much for your time. We appreciate you joining us today.